Hey guys, this is Kate. I am so stoked you are here to listen to this episode all about your metabolism and your muscle and your body and your health through perimenopause and menopause. We have a special guest on today's episode, Dr. Gerace. She is an incredible physician, an incredible wealth of knowledge all about women's health, and she just blew it out of the park with this episode. So you are in for a treat. I wanted to tell you before we get started that this 2026, the first half of 2026, Dr. Gerace and I are going to be hosting a very intimate, small group modern menopause workshop where we are going to help you really make the most of this transitional time, focusing on body composition, your nutrition, and your medical needs. So, if you want to be the first one to receive information and the opportunity to sign up for this live in person workshop here in the Orlando area, make sure you visit go.orlandodietitian.com/menopause. I have linked that in the show notes. All you have to do is just sign up for updates, and we will make sure that you guys are the first ones to get an invite to this very intimate group. We are only going to have limited seats available because we want to keep it productive. So make sure if you love this episode, if this is something you are interested in, you wanted to connect with a dietitian and physician who specialize in women's health, that you go ahead and sign up. All right, enjoy the episode. But you've hit 40 and all of a sudden, your body feels like a complete stranger. Waking up in the middle of the night, kind of sweaty, you're feeling some brain fog, maybe your body composition has changed, and the old things you used to do to help you lose weight just aren't working anymore. Are you wondering if you have entered the land of perimenopause or menopause? Well, join a club of other wonderful women because perimenopause and menopause are inevitable. And our goal today is to help you feel confident going into this new journey. And I'm really excited you're here. We are going to talk about the medical side of perimenopause and menopause and the nutritional side. So, if you don't know me, my name is Kate. I'm a registered dietitian here in Orlando and a women's health expert. And I have a very, very special guest today. I'm so excited for her to introduce herself.
Hi, I'm Dr. Alexandra Gerace. I go by Dr. G to my patients, and I am an internal medicine trained primary care physician up here in Maitland, Florida. So my background is in internal medicine, general adult medicine, but I have developed a special interest in women's health, in particular menopause care. Because as I was, getting into my career with patient care, I recognized that there was such a need for menopause awareness and competent physicians with menopause care. And so I kind of sought out specific training in that and excited to be able to provide that service to my patients.
Yeah, so you used to work in a bigger hospital system, right?
Mhm.
And so now you and your husband, you guys have came together and opened your own direct primary care.
Yes.
So you see all sorts of patients. You just have a special place in your heart for menopause, perimenopause, women's health.
Yeah, exactly. Yeah. So my background is general adult medicine, and I see, women, or excuse me, patients of all ages, men and women. But like you said, I do have a special interest in menopause care. Yeah.
Incredible. Well, one of the reasons you and I met is because I have an in-person nutrition clinic here in Orlando, me and Megan. And we sit here and we talk to people all day long and we will tell them like, hey, you need to ask your OBGYN, you need to ask your primary care physician about certain things that we can't talk about because they're not in our scope.
Yeah.
And over again, people would say, my primary care physician, they either brushed off my symptoms. It's really hard to get an appointment with them. My insurance only covers, X amount of visits. It was just a lot of hurdles. And then some people weren't really like jumping for joy over their primary care physician because their insurance just kind of assigned them one and they just stuck with it because they didn't really want to go. I mean, insurance is just really complicated. So, long story short, we reached out to local direct primary care physicians in the area, and you guys were like, "Come on in." I came in. I was like super awkward. I'm like, "Hi,
Yeah.
I'm in your parking lot." And we came in, and you and I both connected over our passion for women's health. And so that relationship began. And here we are talking about menopause. You're going to teach me and our listeners more of the medical side. And then I'm going to talk a little bit about the nutritional side. And then we have a really cool offering at the end for anyone interested, especially if you're in the Orlando area. So, my first question for you is how do us women know
if we are entering perimenopause or menopause, what's the difference? What are the signs that you see as a doctor?
Yeah, it's a good question, and that's actually one of the most common questions that I get from my patients when they come to see me, especially my women who are in their early to mid 40s, sometimes late 40s, early 50s, because that's, early 50s is the average age that menopause hits. And menopause is, of course, that last period. It was the definition of menopause is 12 months without a period. So it's kind of a retrospective diagnosis, if you will. But the signs and symptoms of perimenopause, which is that transition leading up to that last period, can last for several years and can vary quite widely. But the most common signs and symptoms are kind of the classics, the hot flashes, night sweats. Those are some of those, like, it when you feel it, type symptoms. But some of the more vague ones that I hear are, I just don't feel like myself.
Mm.
My mood is all over the place. I don't feel in control of my emotions. I have so much brain fog. I'm losing track of things. I'm having word finding difficulties, and that was never an issue for me. I've always been sharp. What's going on? Like you mentioned before, some changes in body composition, most commonly feeling like you're carrying more weight around your middle than you used to. And, I'm doing Pilates multiple times a week. I'm eating the same, and I'm still just can't seem to manage my weight like I used to. So those are some of the most common ones that I hear in that perimenopausal phase that are a little bit more vague and, not as clear cut as the hot flashes and the night sweats.
The not feeling like yourself one, I'm not gonna lie, it scares me, and
Mhm,
I went through it postpartum. It's a very different game, but there's a lot of overlap where
mhm.
all of a sudden your hormones are changing, your body changes, and you almost have to it's just hard to step into a new version of yourself if you're not ready. And what scares me about the perimenopause, and this is just me being honest, I'm hoping that our conversation and the more I learn about it will help me feel less afraid, is that what's the positive on the other side?
Mhm.
And do you see anything, all these different changes, not feeling like yourself, the hot flashes, the sleeping bad, like, is there anything to look forward to where you cross over into actual, like, no period, you're
Mhm.
in full-fledged menopause
Mhm.
behind you?
Yeah. I mean, the biggest one is no periods,
Yeah.
that's something that, it sounds weird to say look forward to it, but, women generally don't love having the period every month. And so that's, a big light at the end of the tunnel. But once you get through that menopausal transition, which, the length of time that that lasts varies a lot woman by woman, but, once you kind of get through that and you will start to feel at home in your own skin again. There's a kind of period of turmoil in
Yeah.
between that can be difficult to navigate from a symptom standpoint if you don't have, a physician that you trust who can help you navigate this with you. But also from a social and societal standpoint, feeling kind of alone
Yeah.
because it's something that not everybody talks about, not everybody feels comfortable talking about it or sharing it with their friends and family. And I do think that that's changing. I think that as a society, we're starting to recognize menopause for what it is and talk about it more, which I'm really excited about. But it can feel very isolating when you're in it. But it does get better on the other side of it.
I've heard that one of the coolest parts about going through menopause and being on the other side is, excuse my French, but you just don't give a plush about stuff. I'm like, "Oh my god, it's gonna be so great to really just, like, step into your queen energy and just be like."
Mhm.
I heard this funny story. It was a woman sitting on an airplane, and she was there with I guess she had a group with her, and she asked this woman who had an aisle seat, and she was like, "Do you mind if we trade seats so that I can sit with whoever?" And the woman looked at her and was like, "No." And she was like, "Oh, that woman's in menopause because she didn't feel like she had to people please. She paid for that aisle seat. She got that aisle seat. She wasn't moving." And honestly, the woman telling the story respected it. And I was like, "Oh, that's gonna feel so good." Just be like, "No, I own this seat." Okay, so you brought a book with you, and can we just call this like a menopause Bible?
Yes.
Because I've read this too, and there is a laundry list of symptoms here. And I'm opening the book to find all of the different symptoms that women can experience when they are entering perimenopause. And if you're watching on video, I'm just gonna flash the book to you. This is The New Menopause by Dr. Mary Claire Haber. let me just share some of these symptoms that can happen that I had no idea about. Body odor, that was a postpartum thing. My armpits smelled for a long time, and it was to like get your baby to smell you, I heard, but I think it's just hormones.
Mm.
Incontinence, fun. Itchy skin, itchy ears. Thinning hair. TMJ, which is that tightening in your jaw. Everything just gets dry. Dry
Mm.
eyes, dry mouth, dry skin. Vaginal dryness is also a symptom. Mental health changes, decreased libido. I barely made a dent in this list, by the way. So, when women come into you with any of these symptoms,
Mhm.
how do you introduce the possibility of entering
Mhm.
perimenopause? Because it can be really sensitive. Like, you could
Mhm.
have a patient you've been seeing for years come in and who says, I'm actually feeling some like tingling in my legs. Is it neuropathy? I had a girl the other day who told me that she was having numbness in her legs suddenly and changes in her she was having vaginal pain, she felt. It's not my scope, she's working with a physician, but I was in the back of my head, I'm wondering, I'm like, "Well, is that perimenopause? Could that be?" So how do you
Yeah.
introduce that topic or that conversation to patients when they're only 40 to 45?
Yeah. So from a physician standpoint, one of the most important things is ruling out that there is a different medical cause that could be leading to, say the example of neuropathy. Do we have blood sugar under control? This isn't an uncontrolled diabetes type picture, or some other primary nerve issue. Um, and when it comes to mood, for example, which is a common kind of complaint during that perimenopause phase, making sure that this isn't an underlying just major depressive disorder, or generalized anxiety disorder that is
Mm.
unrelated to hormones. It can, because there's so much overlap in the symptoms of many of these diseases, it can be tricky to kind of pull it apart and sort them into buckets of this is just depression
Mm.
versus this is perimenopause. So really spending the time with her and talking about, not only her history, which, I will go into with all of my patients, but, what symptoms are you experiencing exactly? Describe them to me in detail. When do you feel them? Do you notice certain things are triggering them?
Mm.
What other changes have you noticed? What are your periods doing? Are they
Mhm.
the same as always? Have they changed recently? Are you noticing any other changes, say, in your libido or your skin? Doing lab work to look at not only your hormones like estrogen, progesterone, testosterone, but also checking your thyroid, checking your blood sugar, making sure that there's not anything else that we're ignoring and just kind of blaming it on perimenopause. Because it can be easy to paint with a broad brush
Sure.
of, oh, it's perimenopause, like you saw all those symptoms that can come about during that phase. It's important to rule out other medical causes and really do a thorough history with the patient to establish, you know, can we kind of blame this on perimenopause, if you will.
Well, can I use that as an opportunity to plug working with direct primary care physicians like yourself? Because that just sounds like a journey. I wouldn't want to do that journey alone. And I also wouldn't want to do that journey with clinicians who want to, but probably don't have the time or the ability to be like, okay, we need to like phase out all of these different tests. I want to see you a bit more frequently.
Mhm.
Because with your and your husband's practice, Highlands Direct Primary Care, people can come in and to see you and connect with you pretty often.
Yeah,
Is it unlimited?
yeah. It's unlimited, yeah,
Yeah.
as often as is needed. And for our new patient visits, we typically spend about an hour, just because that's realistically how much time it takes to really do a thorough history. And then for the follow-ups, it varies, but usually around half an hour, and we can do telehealth if needed. So and then we have the virtual messaging in between. So the communication with our patients is kind of an ongoing communication rather than just these discrete, every 3 months, and then I don't talk to you in between. So that makes it a lot more feasible to not only get to know the patient, which is the most important thing, but also kind of make changes along the way, make adjustments as needed, and not have to feel so, piecemealed.
Yeah, well, that's I love that, and I wish a lot of different practices were like that. And that's how our nutrition practice is too,
Mhm.
because we can come up with a plan at that initial session, and maybe it feels great and it sounds great, but then when they go out into real life, something doesn't work like we wanted it to. So we want to be there to help course correct immediately instead of
Mhm.
just being like, oh well, books are full. You have to check with your insurance to see. Do you just know upfront exactly what it is? So earlier you mentioned lab work. You'll run certain labs on women when they may be experiencing some of these early symptoms. You said estrogen, testosterone, thyroid. Are there
Mhm.
any other labs that you will run pretty frequently on your
Mhm.
patients in that 40 to 50 age range when you are looking for menopause and perimenopause?
Mhm. Yeah, absolutely. So, um, from a general standpoint, for all of my new patients, and then on an annual basis, I look to get a CBC or complete blood count, which looks at your white blood cells, red blood cells, hemoglobin, checking for signs of anemia, metabolic panel, which checks your kidney function, liver function, blood sugar, electrolytes, your thyroid stimulating hormone, and then I'll add on, T3 and T4, which are the active thyroid hormones if there's a history of thyroid disorders, cholesterol panel, and hemoglobin A1C to screen for diabetes. So all of that's kind of a general lab panel that I do for pretty much all of my patients. Specifically for the perimenopausal age women, the hormone panel that I typically do includes an LH and FSH, which are luteinizing hormone and follicle stimulating hormone. Those are produced by the pituitary gland in the brain, which then stimulates the ovaries to produce the ovarian hormones, which are estrogen and progesterone. So
Mhm.
I check those as well. Um, Testosterone does play a role. We have less testosterone in our bodies than men do, but we still have it, and it still plays a significant role in our life in terms of libido is a big issue with low testosterone, and so I pretty much always check that as well. And then I like to really personalize the labs that I order, for all of my patients. It's not one size fits all in terms
Yeah.
of what labs I do for absolutely everybody, with the exception of, that kind of annual panel. I do like to check vitamin D levels, yeah, especially my women. Yep. Vitamin D deficiencies, shockingly common.
Oh, yeah.
Shocking because we're in Florida and we get so much sun, but I'm surprised when I see a normal vitamin D level.
Oh, me too. I'm shocked. And what's interesting about vitamin D that I don't think a lot of people realize is it's not really common in food.
Mhm,
A lot of our vitamins and minerals we can get from a, nutritious diet, but a lot of people come in who have really balanced, healthy diets, but vitamin D is low. And really, you need to get from the sun. There are a few foods, fortified milk, eggs have a little bit of vitamin D. But if you're not in the sun enough, you do need to take a supplement.
yeah.
Or at least talk to your doctor. There are some medications that can interfere with high doses of vitamin D, right? Like certain blood pressure medications you have to be mindful of, but talk to your doctor, talk to your dietitian, start a low dose vitamin D, get that tested.
Mhm,
Vitamin D can play a huge role in how you feel, right? If we're going to talk about mood and energy, if iron's low, if vitamin D is low, if B12 is low, those are easy. I mean, you know, relatively speaking, those are
mhm,
easy things to fix to help you feel better pretty soon.
mhm,
Yeah, yeah.
definitely.
I also had a question for you. So you mentioned testosterone, which made me think of PCOS. I have a lot of patients coming in with health concerns and diet concerns with PCOS.
Mhm.
Do you see a difference in how perimenopause can impact women who have pre-existing hormonal concerns, whether that's PCOS or endometriosis, anything in that women's health category?
Um, to be honest, I'm not super familiar with that.
Okay,
Yeah.
yeah, I'm just
Mhm,
curious about
mhm,
that. Okay, I had another question for you. It's actually more of a game. I wanted to rapid fire some common symptoms of perimenopause and menopause, and I want you to tell me your favorite preferred treatment option.
eh,
I know it can be really hard because there might be like three that you would use, but like, what's your favorite? You ready?
sure.
Hot flashes.
Hot flashes, estrogen tends to help most with that.
Ooh, okay. I'm gonna divert from my own game. Topical, oral, either.
So either one's equally effective. I tend to reach for topical first
Hmm.
over oral because oral, of course, gets digested through the GI tract, gets processed through the liver. Some of the breakdown products or metabolites of that liver processing can increase your risk of blood clots
Okay,
for the
cool.
oral estrogen. So for that reason, I tend to reach for transdermal or topical first.
Which is a little less intimidating, I
Hmm.
feel like. Okay, I'm gonna come back to hormonal and non-hormonal treatments. Vaginal dryness.
Vaginal dryness, so vaginal estrogen can help a lot with that. And then non hormonal vaginal lubricants or moisturizers. Yeah.
What about libido, low libido?
Mhm. So estrogen and testosterone.
Cool. What about poor mood?
Mhm.
feeling down.
So progesterone plays a really significant role in mood. So the anxiety, the mood lability, the issues with sleep, progesterone tends to help a lot with that.
Can that cause weight gain?
Can progesterone cause weight gain? It can in some women. It's not a common side effect, but it certainly can. And some women complain of some bloating in the abdomen with
Anytime you play with
progesterone.
hormones, there could be that risk.
Mhm.
What about brain fog?
So brain fog is a tricky one. Estrogen can certainly help, but it is one of those that we really need to take a multifaceted approach of making sure you're minimizing your alcohol intake, you are maintaining your day to day cognitive activities, getting lots of exercise in addition to the hormone side. So that one's not quite a this is the one thing I grab. That's a more complex picture.
Can I suggest a dietitian consult?
Yes, dietitian consult.
So many fun things, dietitian or dietary wise, supplement wise, we can do for brain fog that are
Mhm,
totally safe and well
mhm,
studied. Okay,
mhm.
what about poor sleep?
Poor sleep, progesterone is one of the biggest ones, yeah.
Okay, and then you tell me what's another symptom that you would want to tell someone your favorite treatment for?
Ooh, the ones you mentioned are the biggest
That's
one.
what I thought. I thought I got them. I just wanted to make sure I didn't miss any.
Mhm. Weight gain is a common one, but that's another very complex.
Oh yeah.
That is not. I mean, none of this is one size fits all, but weight management is one of the most common ones that I really try to spend even more time talking about, just because it really needs to be a multifaceted approach, and working with a dietitian would be super helpful for a lot of patients for that.
Well, the weight gain is so complex because it's not just the weight gain, your body composition shifts. So how many times have you ever heard of a woman who says that her whole life when she gained weight, it would be in her hips or her buttocks and she
Mhm.
didn't really hate that, but it was just the thing. And then boom, she goes through menopause and all of a sudden she starts holding weight around her midsection and it can be a bit of an identity shift. Or maybe women that would do a lot of crash dieting. That's a big thing where
Mm.
for decades they just had to drop down to 1200 calories. They could lose the weight. It always worked. Now those strategies just don't work the same. So we really have to do a lot of understanding the metabolic history, understanding our lifestyle. You mentioned alcohol. Megan and I, the other dietitian on Nutrition Awareness podcast, who works with me here at Nutrition Awareness, we have this saying. I don't know if it's a saying, as more of like a really hard realization. Wine just doesn't work for women over 40.
Mhm.
I don't know.
Yeah.
It's like I hear all the time, these women that come in, they don't eat terrible, they eat pretty well, but the wine, it just pours and it flows, and it's just part of their daily life, and it was never an issue until they went through perimenopause,
Mhm.
and that can be a tough pill to swallow.
Mhm.
That just
Yeah.
doesn't work the same.
Yeah, definitely. And it can be a big hurdle to get past when it comes to weight management,
Yeah.
but also sleep and mood. If alcohol is part of your kind of even day-to-day routine, just like one or two glasses of wine pretty much every night, that still adds up to quite a bit of alcohol, and that can be a difficult habit to break.
Yeah.
But can be one of the biggest, you know, game changers, if you will. Once we cut that out completely, ideally, or at least cut it down to a more minimal level, then that can help all of those things.
So I love talking about that because especially with someone who is either postpartum, going through some kind of hormonal change, perimenopause, menopause, their stress can be up, their moods can feel dysregulated, their sleep can be poor. All of those things can be triggers for people to reach for more of those things that almost cause more, add more fuel to the fire.
Mhm.
For some people, it's alcohol. For some people, it's sugar. Typically, that's what it is when they come into my office. I don't know about you. So you really have to spend some time having like a come to Jesus talk of saying, "Hey, I know that wine or sugar has just been part of your daily routine for so long, and it can feel like you're breaking up and you're already going through all these other changes. Are you at least open to running an experiment where for 6 weeks we cut the wine intake by 100 to 50%. We measure all of these other things you're trying to feel better. Are you trying to feel better energy wise? Let's look at your brain fog. Let's look at your weight. Whatever metrics are important to you, can we run an experiment where we change one or two factors? And at the end of it, if we see that there is value and that you feel better, if that feeling better is worth it, then we know what works. And if
Mhm.
it's not, or there's no change, we can go back to the drawing board.
Yeah.
So I think that can be a really disappointing conversation to have sometimes, but very necessary. You will
Mhm.
feel better the less alcohol you drink.
Yeah. I really like that approach, actually. I might steal that.
Please do.
Let's run an experiment
Well,
because then
that
it gives them agency as well.
and it doesn't feel so sad.
Mhm.
Because imagine this, like, this is how I would feel if you told me that I couldn't have my nightly dark chocolate ever again
Mhm.
because it was making me feel terrible. If you told me that, I would be like, "Middle finger, Dr. G." Like, I just wouldn't do it. But if someone
Mhm.
told me, "Okay, are you open to a short-term experiment where we just look at it for data? And if you wanna go back to all of your habits, you can, but just humor me with an experiment," that feels doable. It doesn't feel so sad, and there are so many things happening with perimenopause and menopause. Like, I don't wanna take away the joy from someone's life. I want them to decide if that joy is worth it or not, and we can only do that through experimenting.
Mhm.
So, looking for those other ways to measure progress, I think is really important.
Yeah.
Okay, so I wanted to ask you about hormonal treatments versus non-hormonal treatments for menopause because everyone's always talking about the estrogen, the hormone therapy. My husband even showed me an article the other day. Well, he didn't show it to me. He told me about it and he thought that I would just look it up as if I don't have a million things I'm thinking about. But he said that now they're debating again about hormonal therapy and the risks behind it because for a long time everyone was like, don't do it, it causes breast cancer.
Mm.
And now there's all of these doctors saying, yes, everyone could benefit from it. How do you decide based on a patient's medical history
Mhm.
if she is a good candidate for hormonal therapy? And let's just assume that this specific woman is open to it.
Mhm. Okay. Great question. So, to give a little bit of background, the one of the biggest randomized controlled trials about hormone therapy in menopause that was done in the late 90s, early 2000s was called the Women's Health Initiative. The data that came out of that was very useful, but it was primarily focused on, or I should say, the participants of the study were mainly older women, in their 60s and 70s, who were, more than a lot of them were more than 10 years past menopause. And what they found in that study was that there was an increased risk of cardiovascular disease and increased risk of certain types of cancer, like invasive breast cancer. And so the conclusions that were drawn from that was that hormone therapy in postmenopausal women leads to increased risk of cardiovascular disease and increased risk of cancer. The analyses after the Women's Health Initiative have actually found that those conclusions are really only applicable to the older kind of cohort of
Mhm.
women who are either over this age of 65 or more than 10 years past menopause or both. Whereas if you are younger, so within 10 years of your last menstrual period, or under the age of 65, then the opposite is true. There's
Mhm.
actually an improvement in cardiovascular health and not really a significant increase in breast cancer risk. So the breast cancer picture is a little bit more complex, and that's
Yeah.
something that is, very individualized. And I talk about that with each individual patient. So I don't want to
Yeah,
paint a
definitely.
broad brush. It also is important what types of hormones you're using, whether it's the bioidentical estradiol and micronized progesterone versus the synthetic progestins. So we're getting in the weeds with that, but that's
Get in the
emphasizes
weeds.
the
I want you to get in the weeds because I'm really interested in that.
Mhm. So it's really important to take an individualized approach
Right.
with each patient. So generally speaking, there's what's called the timing hypothesis with menopausal hormone therapy that in older women over the age of 65, more than 10 years past menopause, it gets to be, more of a gray area in terms of risk. When you are younger, closer to menopause, then generally speaking, the risks often, or the benefits often outweigh the risks.
Mhm.
Yeah. And so when I'm talking to a patient who is open to potentially starting HRT or hormone replacement therapy, then I want to know all about her history. Her cardiovascular history. Has she ever had a heart attack? Has she ever been on hormone replacement before, or is this the first time we'd be starting it?
Would you count birth control as that?
I wouldn't count birth control as as HRT.
Right, okay. Would that
Mhm.
influence your decision?
It it could, but it's not the most important thing. So if she is older, so say she's 68 and she was on birth control pills when she was in her 30s and early 40s, then that's remote enough. It's not going to influence my decision. And if at this point she's more than 10 years past menopause and she hasn't had any hormone replacement therapy in the meantime, then that's where we of course have that serious consideration of risk versus benefits.
Mm.
For a younger woman who doesn't have any breast cancer history herself, who's getting her, annual mammogram screenings for breast cancer, then, I feel more comfortable, talking about go ahead and starting HRT. Yeah.
Do you ever look at genes? If women have what is it, the brachia?
The BRCA1 and BRCA2. So that is certainly a factor. If you have a strong family history of breast cancer and you're positive for, the BRCA1 or BRCA2, then that's a risk factor to consider. It's not an outright contraindication or a reason not to do it. It's just a risk factor to consider.
So it's something you would bring to your doctor if you had that testing done, if you had a strong family history, and then you guys can work it out. Who let's say you have someone who's iffy, right? What are the non-hormonal options for treating perimenopause and menopause?
hmm So for what are called the vasomotor symptoms of menopause, which are the hot flashes, the night sweats, there are medications that are in classes of antidepressants, so SSRIs or SNRIs, which are typically used to treat anxiety and depression. Venlafaxine is one of the ones that has had the most or a lot of trials done for treating vasomotor symptoms of menopause, can help significantly. There is a slightly newer medication called Veoza is the brand name that is now FDA approved for treating vasomotor symptoms of menopause, and that can be particularly helpful. So those are, in terms of pharmaceuticals, those are the ones with the most evidence behind them. There are others like gabapentin, clonidine that can show some benefit, but the evidence for it is a little bit more gray.
Okay, gotcha. So they're not like your first initial go-tos. You'd really have to like look at the patient, understand what they've tried, what's worked, what hasn't worked.
Exactly.
Do you see that a lot of women, when they start using hormonal estrogen, do they feel like themselves again? Is that like what's missing a lot, the
Mhm.
estrogen?
So it takes some time. It's not
Mhm.
an overnight thing. But absolutely. I have, female patients who after getting on the patch, for example, after a couple of months, they're like, this was an absolute game changer. I was losing my mind. I didn't know what was wrong with me. And now I feel like myself again.
That must feel so good.
Mm.
I mean, and again, that's why I feel like, well, that's why we wanted to connect with you being in direct primary care so that you could have the time to like go through what's happening with I mean, the ones that I see it with the female patients, because it's just a more complicated puzzle, in my opinion, of what's
It is.
happening. We're just more complex, for better or for worse. So, anything else before we talk about nutrition? I want to talk about this together because I know you work with weight loss, you do the GLP-1s. So, before we go into that, conversation. Anything else you want to share about the medical or medicine side?
Mhm. I think we covered the big stuff. Yes.
Okay, my questions were awesome.
They were really good questions.
Can we talk about my prescription
Yes.
for perimenopause?
Yes, I want to hear it.
And I think this is really important for any woman to hear, no matter where she is. So whether you have a daughter, whether you have a sister, a friend who's not quite in the perimenopause phase, I prescribe protein almost like it's a prescription, whether it's plant-based, whether it's animal-based, it doesn't matter to me. Because when women are eating adequate protein, and I'm not talking 1 gram per pound of body weight, by the way, I think that rumor floats around a lot when they come in and they're like, okay, I weigh 150 pounds. Should I be eating 150 grams of protein? Probably not.
Mhm.
So I just want to put that out there. But protein is so important for, let's just say, 3 big reasons with menopause. Number one is the more obvious one, which is building muscle tissue. And if I could give any woman in my age group, the 30s to maybe even the low 20s, honestly, but especially in the 30s group, if you're building muscle tissue, that's going to set you up for more success in perimenopause and menopause. When you have all of these inevitable body composition changes, the more muscle you have, the more you are going to protect your strength, your mobility, your longevity, and confidence, quite frankly.
Yeah.
So, protein builds that muscle tissue along with strength training. Two, it balances your blood sugar, which is really important. In fact, we just did an episode with our continuous glucose monitors because we have continuous glucose monitors here for patients. We can look at their blood sugars and give them dietary advice. It's really fun. And we were talking about when patients eat protein at the beginning of the day, their blood sugars are more stable throughout the whole day. This isn't mind-blowing stuff, but it's really cool when we see it in a CGM, that data. And why is controlling blood sugar so important? Well, it's not just for appetite control. I mean, that's huge. When your blood sugars are more stable, you're less likely to rely on that sugar and that wine and all that stuff that can wreak havoc on our hormones the older we get. But it also protects your mood. When you have a stable blood sugar, you don't crash. When you don't crash, you're less likely to freak out at your family. You're less likely to be super irritable when you're in traffic, like banging on the horn, right? We've all been there where we're so hangry that everybody is just annoying. Pair that with a bunch of hormonal shifts, you're going to feel awful and no one's going to want to be around you, which would feel even more isolating, I imagine. So having doses of protein, as I frame it, evenly throughout the day just gives you a better chance at being in control of your emotions. And then, of course, the amino acids that are in protein help build and support neurotransmitters. So, your serotonin, all of those things in your brain that help you feel like yourself, help you feel stable, very important to eat adequate amino acids. Those are just three of the reasons. Do you see in your clinic women asking about protein?
Oh, absolutely.
Yeah.
Yeah. It's often in the context of weight management.
Totally.
How much protein should I be getting? And, even that's, I feel like I've said this a lot, but it is very personalized.
Yeah, totally.
And I'm sure you go even more into detail with your clients about it. But it depends on their activity level, whether they're trying to gain, maintain, lose weight. But yeah, absolutely.
Yeah,
It's a big thing.
it's huge.
Mm-hmm.
Another thing that I think is really important that goes with that is fiber.
Mm-hmm. Oh yeah, definitely. I am like, I think Big Chia Seeds should sponsor me because I talk about chia seeds.
Does anyone know Big Chia? We need Big Chia to sponsor this episode. What are you doing with chia seeds? Tell us everything.
I recommend that for just a simple, like, whole food source of fiber for my patients who are maybe complaining of some constipation or, some bloating. I'm like, have you ever tried chia seeds? So my recommended dose is 2 tablespoons a day with, a liquid or a smoothie or however you want. You don't really want to crunch them, just eat them dry, but
Do you do chia seed pudding?
I do,
Yeah.
yes. Yeah, so I'll, send people recipes for the chia seed pudding, and yeah, I love chia.
They're rich in omega-3s for being
That
like
too, yeah.
so if you have never had chia seed, you're gonna go to the store and you're gonna look at it and you're gonna be like, "What is Dr. G talking about? Like, why would I buy bird seed?" So what happens is when you put chia in milk or water, it absorbs the fluid, and so it gets into this, like, nice kind of jelly, tiny ball type of thing, almost like quinoa type.
Or like tapioca too.
Yes.
Yeah.
Just like that, right? So it doesn't taste weird when you have absorbed it, but then you can blend it into certain things or sprinkle it on your peanut butter toast or your yogurt and your smoothie.
Mhm.
I read a thing a long time ago. I should really remember what this was, but there were certain tribes or cultures in Africa that would give their athletes chia seeds for energy because they
Oh,
have a
wow.
lot of nutrition. There was some kind of study, so I can't remember exactly. I shouldn't bring it up if I can't quote it. On my list, something else I wanted to talk about with fiber was, don't be afraid to supplement with a fiber supplement, like psyllium husk. The reason is a lot of times when we are going through menopause or we get older, I mean, as we get older, our energy needs tend to decrease on average, right? Older populations need less calories. You may notice this, and maybe if you have aging parents or aging relatives, they just don't really eat as much and they technically don't need as much food. So if you're also trying to lose weight, we want to be mindful of how much food you're eating. And if we've got protein goals and we've got fiber goals, right? For a woman, the average fiber need is about 24 grams a day. And if you ever track your food, you can see that that's a lot. So if I have somebody already in a mild or moderate caloric deficit and we're trying to hit protein, we're trying to hit all these things, I let people rely on a fiber supplement like psyllium husk because it's really hard. It's pretty like a full-time job trying to meet all your nutrient goals.
Definitely.
So
Yeah.
I get questions about that all the time. That's just me putting that out there. We talked about a big supplement, which is vitamin D. Can we talk about calcium?
Yeah.
Bone health? Do you see a lot of osteopenia, osteoporosis, any concerns about bone health with your patients?
Absolutely. So I do tend to see it more so in my older patients,
Mhm.
the women who are getting into their 70s and 80s. But I have actually seen it in a couple of younger patients who have been on the Depo-Provera shot for longer than they were supposed to, which can increase your risk of early bone density loss. Yeah. So, but
Yeah. Huh.
as we are, getting into and past perimenopause and menopause, our bone density is starting to decrease, our muscle mass is starting to decrease, and so making sure that we're getting enough calcium and enough vitamin D, which is really important for the calcium processing and production in the body.
Yeah.
And so one thing I recommended to my patients quite frequently is the vitamin D3 with the K2 added. The addition of the vitamin K2 helps to enhance the bone health benefits of the vitamin D, targeting to the bone and not the blood vessels, which is not where we want it. And so that's, yeah, definitely something I talk about a lot.
Easy little hack there.
Mm-hmm.
Yeah, and then with the calcium piece, there's something interesting that I thought of. If you have like a Diet Coke or Dr. Pepper habit, you want to kick that because the phosphorus in soda can actually pull from our bone stores and weaken your bones
Oh, wow.
faster. So if I
Mm-hmm.
ever have a woman in her 40s who is like, Diet Coke's my vice, I'm like, oh no, I have to be that person again that says like, hey, I know that you're only 40, but what we do in our 30s, 40s, 50s, I mean, what we do every decade is going to influence our later decades. So not only do we want to weight train to protect our bone health, but we want to be mindful of our supplementation, of our diet, of our risk factors.
Mm-hmm.
For calcium, women need about 1,000 to 2,000 milligrams per day uh, to protect their bones. And it's really easy to get that from food. I mean, it's easier than you would think. I mean,
Mm-hmm.
2 cups of spinach has almost 500 milligrams. It's about half of what you need at the
Mm-hmm.
minimum. So taking a supplement with that might fill in any kind of gaps. So what
Mm-hmm.
would you do here? You could make a chia seed spinach smoothie with protein powder and food.
Delicious.
Yeah, it's just there's your defense against menopause.
Mm-hmm.
I wanted to share one other interesting supplement I think would be helpful for menopause. So I've been talking about creatine a lot. Do you ever bring that up with patients?
I do, yes. I do have patients ask me about that. Yeah,
Yeah.
I would love to hear what you talk about with your patients.
Well, I always am super sketched out about a lot of
Mhm.
supplements. So whenever somebody brings me a supplement, I'm like kind of the Scrooge. I'm like, let me look at Consumer Lab. Let me see if there's been anything that really supports creatine or supplements. But I would say creatine is one of those that I recommend for a lot of people because it's
Mhm.
just being studied more and more. The
Definitely.
studies to me are pretty promising.
Mhm.
And I did read one study, I'm going to link it in the show notes, about how creatine supplementation can help with mood stabilization for women in menopause specifically, which was really cool. I was shocked that they did a
Mhm.
study specifically for women in that age group. And also can help with brain fog. I used it a lot postpartum because it's helpful for improving short term memory, specifically when you're sleep deprived, which would be very beneficial if you are having any changes in insomnia, night sweats, anything that's keeping you from functioning well the next day.
Mhm.
3 to 5 grams of creatine per day. Just mix it in your water. It's clear. It doesn't taste like anything. You can put it in a smoothie, but I just put it in water and just
Mhm.
drink it in my first Stanley cup every morning, and it's no big deal.
Yeah.
And it helps your memory, your focus, your mood, and of course preserving lean muscle tissues.
Yeah.
Reasons it got really popular.
Yeah, I was gonna say the muscle aspect is I think why it kind of
Yes.
became popular, but now we're starting to see so many benefits of it. So it's really exciting and I'm eager to see where that research goes.
Yeah.
One caveat from the medical side, just to keep in mind if you are somebody who likes to take creatine, is sometimes it can show up on your labs in one of the main kidney function markers that we look at on your metabolic panel, which is your creatinine.
Mhm.
And so taking creatine on a regular basis can sometimes kind of bump up that creatinine level, which looks on paper like a kidney injury. It's
Mm.
not an actual kidney injury. I've talked to my nephrologist colleagues
Yeah.
about this. So it's kind of a artifact, if you will, of taking the creatine. So there are other blood tests, like cystatin C is what it's called, that can help you to distinguish whether this is kidney injury or an artifact of creatine use. But that's just something to keep in mind for people who do use creatine. If on lab work you have, in between when you started taking creatine and before that, if you now have a bump in your creatinine level, it's just something to keep in mind. Definitely make sure with your alongside your physician that this isn't a kidney injury,
Yeah.
but yeah, it's just something to keep in mind.
So saying that, I would think two things is one is staying ultra hydrated. which is important, period. Can't that help
Yeah.
that level? And then also telling your doctor straight up, don't lie, don't forget. Every time you go see your physician, make sure you tell them about any new supplements you're taking and your vitamins. Same thing with your dietitian, because some things can interact or have. You wouldn't want to be terrified that, you're feeling great and then all of a sudden your kidney levels are elevated and your doctor didn't know.
Right.
So
Exactly.
make sure you're really upfront and honest.
Mm-hmm.
Cool. Okay. And then I had one last piece of advice, and I kind of touched on this earlier. Um, it's to women who maybe aren't in perimenopause yet, or if you love a woman who's not in perimenopause yet. This is something I feel really passionate about. Is telling the younger women that right now in your 20s or your 30s or your early 40s, if you haven't experienced the symptoms yet, to become very selfish with your health. And what I mean by that is I've been a dietitian in private practice for 8 years, and I work a lot with women. I would say it's about 60% women, 40% men. And a trend I never see in men is that women will compromise what they need to do for their health for others. I think it's just like in our lifeblood to be like, okay, I'm going to give to everyone. I'm going to give, give, give. I feel guilty for closing my laptop at 5 p.m. to go for a walk before the sun sets. I feel guilty if I leave my husband with the kids so I could go to the gym with my friends. I feel guilty if I don't make my kids what they want for dinner. So I just make chicken nuggets and mac and cheese over and over again. I would tell you to ditch that mentality now, because it's so much harder to change your habits, your health, and your body composition
Mm-hmm.
the older you get. And that would be the piece of wisdom that I'm trying to embody now in a really tough season with a small kid and being a working mom. I'm like, okay, no, like it's so important to maintain these things now so that I feel good in my 50s. And I would love for every woman who's experiencing perimenopause and menopause now to share that wisdom with the younger people in their life.
Yeah. Absolutely. I love that.
So I wanted to share with everybody listening a fun announcement, and then Dr. G, I'm going to have you end with a question. Sound good?
Okay. Sounds good.
So we are doing something really cool. We're teaming up together early 2026. The date has not been officially decided because we may have another special person joining us. But we wanted to create a really intimate, personal space for women in the Central Florida community to come together and talk about menopause and perimenopause and their health in a place that feels safe, but they can also get that information they need. Because there's only so much we can talk about on a podcast. Like, I don't know about you, but when I listen to a podcast, I always leave with a million questions that relate to my own life. So we wanted to create an in-person workshop experience at the beginning of 2026. If you want to be the first person to know about this specific event, we have a link where you can just put your email in and you'll be the first to know. There's going to be limited seats for this. We want it to stay personal. We want it to stay intimate. So we'll just give you guys the first no before we announce it to everyone. I'm linking it in the show notes, but the place to get the first insider information is go.orlandodietitian.com/menopause. Make sure you spell dietitian right. It's DITITIAN. It's all linked in the show notes. Just plug your email in and we will send you an invite as soon as we get that going. But it will be an in-person experience in the Orlando area.
Yeah. I'm super excited about it.
We're stoked for it. I know. Well, when we first met, I was like, I was like this nervous dietitian in front of physicians. I was like, would you guys ever want to do a workshop? And you were like, I've actually always wanted to do a workshop. And I was like, oh my gosh, this is fate. So my last question for you, Dr. G, is what is the one thing you would tell every woman in the midst of her menopause journey?
Mm-hmm. Biggest thing is that you're not alone. This is something that, if we are blessed enough, honestly,
Yep.
to live long enough, we as women will all go through it. And, 70 to 80% of women going through perimenopause and menopause have symptoms, and a quarter of those are severe. And so, what you're going through, you are absolutely not alone. And there is a lot of support out there. And I would encourage any woman going through this, or even if you think that you may be going through this, to, reach out. And, if you don't have someone now, getting established with a physician who you feel comfortable with talking about these things, and who, has that confidence level, is having somebody to, help you navigate this, can help so much.
Yeah.
Not only from the treatment standpoint, but also just to not feel alone in it.
What if they wanted to work with you? If they want you to be that physician, how do they contact you?
So you can find me on my website, which is Highlands DPC. DPC stands for directprimarycare.com. So it's Highlands with an S, DPC.com. So it's myself and my husband, Dr. Morrissey. We're the two doctors in the practice, and we're still accepting new patients. We are anticipating possibly being full by the end of next year, which seems crazy.
What?
Yeah,
Congratulations.
thank you.
Would you bring on another position?
We are certainly talking about that. We are discussing different options of, bringing on the physician's assistant to help us with some of the patient care, or bringing on another doctor. But yeah, it's exciting.
Congratulations. So you guys are really cool. I went and visited your office. It's very nice. It's very very welcoming. You and your husband both had really great energy. Obviously, I liked you, so I asked you to be on a podcast and work with you further. And you guys are really transparent about your pricing. I think that's one of the most important things. I mean, we're the same way on our website. We do not want anyone to get a surprise bill or not know what they're walking into. And I just think that's part of being healthy, is having financial health as
Yeah,
well. So
100%.
I appreciate you guys being transparent about that. So I'm going to link all of Dr. G's information in our show notes so that you can connect with her. As always, our information will also be in the show notes if you've got any questions for us. But if you loved this episode, please be sure to share it with someone you love. And don't forget to sign up for workshop information and other cool events we'll be doing around women's health. We will see you guys on the next episode.
Thank you.